viewers know, we're putting the iodine on because we want to use an antiseptic to keep it clean. I'm even going to turn on a bright light for it so that, there we go, so it's easier to see. But before we do that, we need to numb it up. So, you want us to numb it up.
Oh, yeah, it'd be nice.
So I'll go ahead and get some anesthetic drawn up while Polly finishes doing the prep here. Oh, you're anonymous. While anonymous nurse finishes doing the, whose son is probably watching on Periscope. While I go and, I'm going to draw up some lidocaine and some sodium bicarbonate, which is a buffer. I'll just put this right here while I do that. In case you guys are wondering, we're on Periscope over here, so.
Oh, cool.
You familiar with Periscope?
Is that like the telemed?
It's, I guess it's kind of like Snapchat, but a little more refined.
Oh,
So
no, I haven't seen that.
people who subscribe, and it's hooked up with Twitter.
Cool.
People who subscribe can watch medical procedures.
Oh, really? That's
Yeah.
awesome.
So, drawing up some medicine here for a punch biopsy. So, lidocaine with epinephrine, and just a kiss of sodium bicarbonate to make it not burn as much, which everybody appreciates.
Yeah, for sure.
And get rid of the sharps over here off to the side. Oh, by the way, if you know how to tell your friends if they're interested in this, go ahead and tell them they can watch too. And I'll try to respond to hearts and comments as they come up. That's how people tell you they like you. They tap the screen, it gives you hearts.
Oh, cool.
That would restrict the anesthetic locally, I presume. Yeah, actually it does. Whoever asked that. Yes, that's right.
Cool.
It helps to keep the anesthetic where you want it instead of going other places, so it lasts for longer. Lidocaine and epinephrine, yes, that's right. Lidocaine's the anesthetic, epinephrine to close down the blood vessels. So it doesn't bleed as much. That's kind of a nice thing too. So coming back, I'll just kind of set this up over here in the corner while I inject the.
Who do you send this to?
It's actually whoever wants to watch. There's a number of people who have just kind of come across it by looking on the internet, and other people who happen to follow my social media feed.
Do you want a picture of what you're doing there?
Yeah, but we have to keep him anonymous.
Okay. Do you know what suture you want?
I would like a nylon. Actually, do you want to come in to have the suture removed, or do you want one that will go away by itself?
The way by itself is.
Okay, so we'll go with a 3/0 Vicryl. So different types of sutures will either stick around and you have to take them out, or they can be absorbed by the body. And there's pluses and minuses to each, but the convenience of having it go away on its own is the reason that we go with it in this case. And then I'm going to throw a fenestrated drape to keep everything sterile while we're working in a sterile field. And before I put on sterile gloves, I'll need to hand the phone over so you can hold. Since you don't have to use wound seal, we can just do this. You want to come on this way?
Yeah, that'll be good.
So I'll be getting the sterile.
Now I'll be blocking the light.
You blocking the light there? So I'm getting sterile gloves on over here. And I'll be getting the punch instrument over.
This come up
On your computer?
computer, Facebook.
I can make it so it will. I can put it on our YouTube so it comes up. And, oh yeah, you can share it on Facebook if you'd like. You can say that was me, even though it doesn't show my face. Sterile drape. Yeah.
I'm going to come around and give you some direction.
You're thinking about it.
I have a lot of. My wife wanted to take a picture of me, and she did
Oh, and you didn't like it?
Well, I deleted it.
My kind of man.
Yeah. Throw it sharp.
There it is.
Why worry the kids?
Why worry them?
Oh, that was simple.
I'm going to put it into a little container.
I'm not gonna move the camera. People are already.
Just gonna
throwing
do
up.
it all in one take. That's the way Polly works.
What I want you to do is grab some gauze pretty quick here.
Yeah. All right. I'm gonna go get some more gauze because there's another little drop trying to form. There we
You know, I think that my metoprolol,
Mm-hmm.
it must thin my blood or something.
Well, it's not supposed to.
Well, something.
Let me push that in. Are you taking aspirin? Aspirin does.
Oh, does it? Every day I take.
That'll do it.
Yeah, we're having to fight the aspirin here a little bit. That's okay. It'll.
Yeah. Just put a Band-Aid on it.
We will. After I close it, though.
You have to get somebody with longer arms next time.
So you can back up a little bit. Pull that out of the way. How are you feeling?
Good.
Not hurting?
Uh-uh.
Did it hurt when I gave you the shot?
You give me no.
You didn't even feel a shot?
Uh-uh.
I guess that medicine we use works pretty good. Works well. Okay, so that thing is in place. Throw away my sharps, and then we'll, as soon as I get my gloves off, we'll switch roles there, Paul.
Good.
Because we're switching from me doing all the work to you doing all the work. Okay, so we'll close this out, see what people are saying. People are writing in other languages I don't even know. Looks like Arabic. All right, so, oh, they're giving lots of hearts too, of course, we like that. And follow if you want to see more from @Dr. Vaughn, and thanks for watching. Until next time, this is Dr. Vaughn telling you to stay in good health.